But what happens, interestingly, when you get that good morphology, cosmetics and aesthetics is a natural byproduct. So if you will restore the form, yes, you will be concerned on the posterior teeth. Right here, you want, you have good occlusion for the teeth, not to chip, not to break, be quite stable, have enough room for your porcelains, restorations, whatnot. You will restore it to the good shape and form. It will look aesthetic. It cannot not look aesthetic. It's just a natural byproduct, I think. So it's very important.
Right. Okay. So Jurgita, I get your point, but okay, nowadays everything's going digital, right? Like you send something to your technician, and he or she is like digitally waxing it up, and maybe the whole workflow is getting digital, and even to the extent that if you're doing your composites nowadays, there's so many different companies like SmileFast, for example, where you get your stent, the anatomy's pretty much built into it. So should you therefore be investing, if you've got a finite amount of time, which we all do, and it's like a budget, for example, in terms of how much time we invest in learning, should we, instead of learning about morphology, invest that time in learning how to work the different softwares, how to do a digital wax up? I'm playing devil's advocate here. I appreciate that.
Yeah, that's a really, really good point. And don't get me wrong, I love digital dentistry. And I have to admit, I'm quite early on and I'm quite on a steep learning curve. I'm trying to really catch the wave and ride it. And I think it's an absolutely amazing tool, especially when you plan your cases, especially when you have the patient in your chair and you try to visualize both for the patient, for him or her to be able to see, and for yourself when you're doing the treatment planning, right? You need to start with the end result at the end of the day. And the basics of the treatment planning is that you start with the end result, and then slowly you try to work your way backwards to see what you need to do in order to get to that result. And I think the digital dentistry is absolutely amazing. It's very, very quick. But also there are a couple of issues with digital dentistry. I think people take it that as if digital dentistry is artificial intelligence, as if you upload everything to the software and it will do everything for you. Well, at the moment, at this point in time, it's not artificial intelligence. It's still being used by human intelligence, which means that there is an actual person, whether it's going to be you or dentist or the technician, it's an actual person who's going to sit behind that software and is going to pull out these tooth morphology libraries, and he's going to upload that and select the form that fits to that patient, will adjust that form in order for the occlusion to be well and functional, etc. So you still need the human power and you still need to have that knowledge. So let's say you can solve that just by exporting everything to the lab, and the digital technician will send you back the models. You can do your mock-ups, etc. Now, imagine what happens if technologies don't get everything right. There is an actual human being in your chair. Now, the tooth morphology on its own, without other smile components such as the face, the lips, the gingival components, the skeletal patterns, means nothing, right? So you're going to try everything that digital software produced for you, and you'll see that, it doesn't look right. So if you don't know the morphology, how are you going to tell the software change this or change that? It's not the artificial intelligence. You need to have the power in order to use the digital technology.